You're listening to Being Built. I'm Aaron Davis, the founder of Reckless Tech. We're an executive search and tech staffing firm. Here with Liz Johnson, and you are...
I am the innovation specialist at the Dayton VA Medical Center.
Nice. Okay. Thanks for being here.
Thanks for having me.
Yeah. So tell me a little bit about what you do for the Dayton VA.
I'm very new to my role. We just became an iNET site at the beginning of fiscal year 24, so October 1.
Okay.
I've actually been with the Dayton VA Medical Center for about 18 and a half years, but new to this position there.
What did you do for the majority of that time?
So majority of that time was I was spent doing admin work for a variety of different services.
Okay.
I worked in the executive office for about 6 years there. And then before I took a promotion within police services. And I did some work there in the federal court system for treatment in lieu of conviction program for veterans.
Interesting. Okay. So you've seen a lot of different stuff.
Yeah.
That's cool.
So.
And getting to work with the executives in the organization, you also get to see like a good mix of like strategic stuff and tactical stuff too, right?
Yeah. A lot of experience there. So that was, I was fortunate to spend 6 years there with them.
That's cool. Well, congrats on the recent
Thank
promotion
you.
or move into this role.
Yeah. So with that being said, some of the innovation specialists responsibilities are really just being a liaison between frontline staff and the resources that they need to innovate within VA. So, for example, if an employee comes to us with an innovative solution, whether that be a product or a program, a prototype, something that they want to 3D print, I basically make sure that they have the resources available to innovate their idea. Okay.
So you can create IP for the VA essentially through other resources that you access externally, or?
Yeah. So we have some internal programming that we offer through our iNET ecosystem. Really just depending on the type of project or the type of product it is, will determine the path that they take. So we have what's called a Spark Seed Spreads program. We have a Go Fish program for sites that are not currently iNET sites and don't have innovation specialists, but we can sort of work collaboratively with them to assist their employees.
Okay.
And then if it's something that is beyond our scope locally, then, we partner with people in the community. We do community collaborations. That's part of the reason why I was at Launch Dayton, where I met you. And really just focusing on how we can get them whatever resources they need for whatever type of project they're working on.
You referenced iNET a couple of times.
Yeah.
What is that?
So the iNET is the Innovation Network.
Okay.
It is a national program that currently has 43 medical centers nationwide and is home to just a little over 50 innovation specialists. Some sites have more than one, other sites don't. Part of that ecosystem, what that means is you're privy to some of their programming. We have a program curator. His name is Matt Knight, and he puts together training opportunities both at the local level and the national level. And part of my responsibilities are to train staff locally at my site on those local programmings.
What's your engagement like with the broader iNET team, the other innovation specialists, and like, do you guys meet all the time, and how do you share resources and interact with the rest of the iNET, people?
So we're currently broken up into VISNs. So think region-based. And I am personally housed within VISN 10, which is made up of 11 different sites in Ohio, Indiana, Michigan. When we joined the network, Cincinnati, Columbus, and Cleveland were already 3 sites that were part of the iNET. So I actually joined a very robust team of iNET specialists. So we meet weekly as a VISN, and we go over sort of happenings within our own VISN and then sort of what we're doing at each of our local sites. We share resources via email or Teams chats. We have our own little Teams channel where we'll drop links, or if I'm offering a class at my site, I'll record that session and then they can go back and use it at their sites. So we're not kind of constantly reinventing the wheel. We're all just sharing resources.
Yeah. I was going to ask about that because, with 50 some different innovation specialists across the VA, sometimes I had a great business idea a couple of years back. And so I started creating this technology solution for the market. It was in the staffing industry. And as I started building it, and researching, I learned that like 3 or 4 others were building something very similar. There's actually now there's like 20 that I've found that are doing something very similar. I abandoned it because I ran into problems, and a few others had a couple of different takes on it, and it's cool. But all that just to say, it was a firsthand experience observing how sometimes it's just time for something to happen in the market.
Sure.
There's no real like first creator of something, because you're all just kind of borrowing a couple of different inspirations or insights about how something can be done. So I don't know if I was first or not with that particular mechanism I was using. It's really hard to tell. But what was really obvious from that experience was that it was time, right? Like the capabilities and the perspective or whatever that brought that particular model to life felt like it was like an appropriate time in the market for that to kind of become an effective thing. So that being the case, I would imagine with 50 different innovation specialists, you probably run across situations where different hospitals are trying to, shopping for the same kind of innovation. Does that happen?
Yeah. The great thing about iNET is we have a diffusion marketplace as part of the ecosystem. So, for example, if an innovator locally here in Dayton, say at my site, comes up with something that other VA sites nationwide want to adopt at their site, through the diffusion marketplace, we can do that. So right now, the VA we have over 1,200 medical facilities nationwide.
Dang, really?
Yeah, and we serve over 9 million veterans. We're the largest integrated healthcare system in the United States.
Yeah, I had no idea it was so big.
Yeah.
And I'm a veteran too. I don't know why I just never knew that.
Thank you for your service.
Yeah, it was a long time ago. I knew like Kaiser, and I've heard of a few big ones, but I didn't realize the VA was the biggest.
Yeah, so it's the largest integrated healthcare system in the country. So that's sort of the beauty of iNET is we all come together. We're collaborating all the time. Like I'll be in DC next week at Innovation Experience, and essentially it's just a place for all of these crazy innovative ideas to come together and then say, hey, do you like this? Because if you do, you can take this back to your facility and you can do it there too.
It's the fact that there are resources available to you to utilize that keeps you from doing double work or working over each other. So I'm really curious about the way innovation happens within, a medical facility, within the hospital. Can you maybe paint a picture of like how a particular innovation happened?
Yeah. So
give me an idea of how that whole thing comes to life.
Yeah, I'll give you a great example. Actually, we have a physician by the name of Dr. Robert Short. He is an interventional radiologist, and he is sort of a champion for innovation at our site. He currently is working on what's called the MINT clinic. It's the minimally invasive nodule therapy, so MINT. And essentially what he's doing is he has taken what traditionally in the VA healthcare system was a 90-day process. From the time that a spot was noticed on an image in the patient's lung to the time that they were able to get a pulmonary function test, to whatever workup they needed, and then to come in for the actual biopsy, receive a diagnosis, and then begin treatment. That was typically a 90-day process. He has found a way to change the way that we're delivering that care to those veterans, specifically lung cancer patients, and he's currently doing that in less than 7 days.
Wow. Okay.
So he really started looking at, why can't we just do this like as a one-stop shop? They're already here. They're already having the test done. Why can't I have a pulmonary function doctor in my clinic doing the test the same day that we're bringing them in for whatever other test they were already going to be there for? And essentially now with his MINT clinic, we are able to deliver the same care that they would have received in 90 days in less than a week. So when you're looking at a lung cancer diagnosis, time is of the essence, right? So
True.
Starting that therapy right away to, intervene as much as possible, that's critical. And especially when, you talk to some of these patients and you talk to their family members, one of the most important things to them is how much time do we have? How much time, when's the next test going to be? How long is it going to take for us to get scheduled for that next appointment? Those are the things that they're very concerned about. So being able to really like limit that for them and say, hey, we're going to have this done this week, it takes a huge burden off the patient and their family. So he's done some incredible things.
When you think about 90 days, that's a lot of anxious worry,
Sure.
right? That's a lot of time to be waiting and worrying, because that's a big burden when you're dealing with a traumatic diagnosis like that. That's a big, just to wait for service. So yeah, that's a big deal. That's a huge accomplishment. A couple of questions about that.
Sure.
I'm assuming a process that formerly took 90 days, there were reasons for that, right? Like what was being accomplished, or were there decisions that had to be made in the in-between time what was the reason for it? I don't know what all goes into that, but
Sure.
Were there reasons why those things took a long time?
Yeah, so we have standards nationally that say, hey, when a consult is placed for you to see this specialist, we have 30 days to see you. That's our time frame. And he just really wanted to think outside the box. Like, why? Why do we have to wait 30 days? Why can't we do it faster? Why can't we do it sooner? We're here, we're doing the work, we have the staff, we have the people, like, let's make it happen. So, he came up with a process and basically said, I can get X, Y, and Z done day 1. And then day 2, we'll have the results. And then by day 3, we can bring them back in. We can do the biopsy. We're sending them to the lab. We're getting those back within 24 hours. So there's no reason why we can't have this done in 7 days.
Yeah.
So just really, I think breaking through those barriers of what traditionally has just always been sort of like, well, that's the VA way. Well, that's the way that, we've always done it. We've always had a 30-day turnaround time for consults and things like that. So really just him really being a champion for those veterans and saying, like, we can do it sooner.
Well, when you're working in a big organization,
yeah,
you have protocols and stuff for a reason, right? You have standards or whatever. So that's a great success story and a process improvement that kind of challenged why is there a 30-day deadline on something that could be a 1-day deadline, right? Were you part of that innovation process, that particular story?
Not for this particular one. Right about the time that I was coming into the innovation program, I had learned very quickly of who Dr. Short was, and everyone talked about he has this incredible board down in his suite, and he actually wasn't there that day, but another employee had taken me. They're like, you got to see this board. And so I went down there, and the only way to really describe it to someone who has never seen it is it was very Sheldon Cooper-ish.
Right.
It had like...
It looked like a conspiracy theory set of strings and sticky notes.
It was like such. Letters and numbers, and they were color-coded in formulas. And of course, I had no idea what I was looking at, but it all makes sense to him. And so he loves to talk about it. He loves to share really with anyone sort of, like what his mindset is and what all those things on that board mean and how he's going to translate that into something positive for the veterans. So, I wasn't actually part of that, but moving forward, we're working on some other innovative products with Dr. Short. We're partnering with Wright State University, and in addition to being an interventional radiologist, he's a biomedical engineer by trade.
Oh, really? Okay.
So he has a unique background, and he really wants to partner with biomedical engineering students at Wright State since he's a graduate of that program, and he really wants to help them work through their senior design projects. Okay. And so right now we're working on setting up a 3D printing lab, and we're going to look at making 3D printed injectable molds to replicate tumors, and then taking those tumors and making them out of different materials to test pressure injections for delivering medication in vivo to tumors. So how do we measure that pressure in vivo? How do we deliver the medication that he wants to inject in these tumors? And before we do it in a human, obviously testing it in a simulated environment. So
yeah, you're replicating or modeling tumors with a 3D printer. One of the things that I imagined you doing is figuring out what's the right material or or strength of that particular simulated product that you create. How do you figure that out? Is it figuring out the right plastic or something? Like what's involved in that?
That's a great question.
Probably for some biomedical engineers.
Yeah, probably for one of those biomedical engineering students. So, that's all part of their project is testing that, and is a rubber material versus like a filament, different types of filament material. Like what's going to be the best option to test those pressures?
Yeah, I guess all the material science that goes into that is its own little subsection of that project, right?
To be determined.
That's right. One of my first guests actually on this podcast was a biomedical engineer by training who later became a software professional.
Okay.
Worked in healthcare doing biomedical. So he was a kind of a new grad, and then got pulled into some kind of technology solutioning. Oh, we need a database for that. Next thing you know, he's a software developer and now running software teams. And so it's funny how the paths that we all take can cross each other, right?
Yeah.
So the innovation that you engage in and that the VA kind of commits to building is kind of, what you just described there was a process improvement innovation, where you're kind of like, challenging protocols and how different parts of the organization interact with each other. And then also some actual product development stuff, right?
Yeah.
Which do you see more of, or is there a third or fourth kind of innovation you guys get engaged in?
I think there's a good mix. So that process improvement, we really leave that to our systems redesign team.
Okay.
So within our quality management service, we have a systems redesign coordinator.
Okay.
And I work very closely with her. So we always make sure that anything that's a current process that's already in place that we're just improving upon, that really goes through her and her team. They're, yellow, green belts, and they do a lot of that work. That's
all the Six Sigma, Kanban, all that fun.
Yeah, they're the SMEs for that. When it comes to like new novel products or programs, something that really sort of, like you said, disrupts that everyday process or what we've been doing for years or what people say, oh, well, that's just how we've always done it. Those are the things that we're taking on in innovations. Okay. So new novel methods for care delivery.
Yeah, and I could see where you guys would bump right up against each other. Sometimes have to negotiate, is this you, is this us?
Yeah. We have a very strong working relationship with them. We do a lot of overlap. So
nice.
We have a pathway to improvement portal and an innovation committee that they all sit on with myself, and we create a path for those employees to make sure that they're getting the best solution for whatever it is that they're working on. So they may come to me and say, "Hey, I've got this great innovation idea," and I may say, "Well, you're right, that is a great idea, but that's more systems redesign." And then I'll do sort of a warm transfer to Cindy and her team, and they'll take that on, and vice versa. So we have a great working relationship with them.
Nice. Good. So stuff doesn't get missed.
Yeah.
Kind of stay, make sure that they're talking, and right? That makes sense.
Yeah.
That's good. So the stuff that kind of falls in your lane, it's not all product though. Some of it is more kind of transformational. I don't know how you would describe the different kinds of innovation that you do, but
it's not all product. Sometimes it's just a project. Sometimes it's a program. So, maybe it's a new novel program that we've never offered before, but, it's going to somehow impact the lives of veterans. So right now I have another employee who's working on creating a new way to have employees fill out reasonable accommodation requests. So there is a current process in place. This is not a process improvement. We're not improving upon what the current process is. We're saying, no, we want to get rid of that altogether, and we're going to create a new way to do it. Okay. So it just depends. I do have people who are interested in doing, rapid 3D prototyping of a device or an assistive piece of equipment that's going to attach to an existing piece of equipment that a veteran may be using, like an assistive device or something like that. So it just varies.
One of the questions that came to mind as you were explaining that was the employees that bring innovation opportunity or interest to you and the team that you work with. The first example you gave was a physician. And Are they always doctors that are bringing these innovation initiatives to you, or?
No, it's really frontline staff.
Is it?
And so you think about those people, even from, the clerks or the MSAs that are checking the patients in for their appointments, to the nurse at the bedside. What I find most often is that the people who are working sort of that frontline direct patient care, they're the ones who constantly are finding things that don't work. And so, what do you do when you find something that does? You create a workaround, right? And oftentimes I don't think what they realize is that workaround in and of itself is innovation. They've innovated a way to still deliver that care to the patient, but work around whatever it is that was stopping them, but they're still ultimately at the end of the day, they're still getting the job done.
Right.
So one of the things that I'm working really hard to do right now is sort of changing that culture, is telling them like, hey, because people are like, oh, I don't have time for innovation. I just have too many meetings, or I have too many of this, so I can't do that. And it's like, no, you're already doing it. Like, you're already innovating things. You just don't realize that that's what it is. And so it's really trying to change their mindset and making them realize that even sometimes just those little workarounds in their day-to-day is innovative all in itself. Yeah.
How do you tell the lazy person who creates shortcuts that what they're doing is actually brilliant without praising, rogue, non-compliant behavior?
Yeah.
Because sometimes it is sometimes compliance with this process is just so stupid that smart people cheat it.
Yeah.
And so you want to praise them, but at the same time, you don't want to encourage bad behavior. How do you deal with that?
We have a praiseworthy scale, if you will.
Okay. Interesting. So you formalize this, as an organization, you formalize the answer to this question.
It's very formalized, like what steps 1 through 9. So, I think celebrating failures leads to greater successes. Obviously, we don't want to fail when it comes to, a patient or taking care of a patient or something of that nature. But, when we're looking at these products, or we're looking at these programs, or we're looking at different innovative ideas, and somebody says, oh, I've got this great idea, and, we get halfway through it, and then it's like, okay, but we can't take that to implementation, because of this or because of that. That's okay. We should still be celebrating that, right? Because one, it took a ton of courage for them to even stand up and say hey, I think I have a better way, or I think I have an innovative solution. So, even though, it may not be successful, maybe not be something that we can implement, it may not go, the way that they envisioned it going, or even me for that matter, things change, and we're all about pivoting. So
it's the right kind of engagement.
Yeah.
So you want that mentality to kind of be encouraged.
Yeah,
right?
Exactly. So I will take an innovative idea or solution that fails any day over nothing.
What's on the dark side of that scale? The not so praiseworthy.
When it's intentional. So if you're intentionally, sabotaging something and it fails, then those are the things we're not celebrating.
Right.
But if you're doing it with the mindset that this is going to somehow improve something or make something better, even if it doesn't,
improve care, you're still trying to improve service quality, that kind of thing.
You're still an innovative thinker, in my opinion. So.
Yeah. I thought of, when you said you have invented something, I thought of the dirt path cut across between the sidewalks. It's we've innovated the dirt path, right? Yeah. In other words, that sidewalk was laid out in the wrong place, right? All those little, memes, innovation memes. Yeah, but you know what else I thought about when the shortcuts is, I just filled out a form today, actually, for a service provider that I'm working with. And they'll go fill out all these forms for us. And they highlighted for me the things I needed to fill out. And I just thought, why didn't you just change your form?
Yeah.
Right? You have
out all the other things.
This form with a million fields I don't have to fill out.
Right.
I'm guessing it's not the first time that's happened. Probably not the last, right?
Right.
Why doesn't she just create a new form, or right?
It's a great
go through the process of
filling
out all these new forms. And anyway, sometimes things are just broken, and finding and celebrating the people who are cheating, if you will, but cheating in a good way, right?
Right.
What's your process for like initiating an innovation? Like, do you hunt them down and find them in the organization, or do they come to you? Like how do you connect with innovators within the VA?
More than not, they come to us. I've really spent some time sort of marketing myself and putting myself out there as like, hey, I'm your innovation specialist. Come see me, call me, email me, send me a Teams chat, track me down in the hallway, however you want to get a hold of me. But sometimes we'll hear of something that's going on in like a clinic, or somebody will say like, hey, have you talked to, Susie over in X-ray or wherever she works? And like, she's got this really great idea, but I don't think she's doing anything with it. Or, so a lot of times it's coworkers sort of advocating for other coworkers. Like, they'll
tell on each other.
Yeah,
so smart. You need to talk to them, right? Yeah.
Like, hey, I think she's got this great idea. She doesn't think it's a great idea, but like, maybe you can help her out.
Yeah.
And so sometimes it's just really going to those people and just making them really realize like, hey, you've got something here, and sort of being that champion for them, or that cheerleader to try to, get them moving in the right direction.
Mm-hmm.
We have a portal they can submit ideas to. It's a very, drop down box, check this, check that. And then based on the answers and how they respond, it'll route to the right place. And then we review all of those as a committee, and we sort of triage them. Sometimes they may check that they're not sure what type of project it is, and then we can look at it and say, okay, that's really systems redesign, that's Cindy and her team, or okay, that's really innovations, that needs to come to Liz, and we sort of go from there. So yeah, it just depends. We get stuff from people coming to us tracking down people that we've heard have something great that they don't want to talk about, but their coworkers are talking about it, and then people who go to our portal and fill out the information.
In large organizations, there's a lot of programs or initiatives like innovation, process improvement, compliance, cybersecurity, that just require a tremendous amount of internal marketing. So we're all, as leaders and doers in the organization, we're all competing for the team's attention to certain objectives. And so much of success in things like that, compliance, innovation, whatever, is about making everybody aware of this, that, and the other. But everybody only has so much mental bandwidth, right?
Sure.
So while one person might pay particular attention to process improvement, they might completely miss or barely kind of consume and digest the cybersecurity education or initiative, or, be on alert or whatever, right? It's funny to think that we're competing internally for all of those and 10 others, really important initiatives within large organizations that require us to constantly be competing for mind share in the team's daily life. But it sounds like a lot of what you're doing is like, think about how this can improve the organization, or think about how we can transform the way we deliver service and care. How do you deal with that competition? I guess that's one question. And then two, do you ever find yourself crossing over other spaces, not just the process improvement folks, but other initiatives or efforts like compliance or whatever else in the organization, and finding leads and opportunities through them?
So with the competition, I don't tend to look at it like it's a competition. Other people are focused sort of on like what they're doing, and I'm sort of just focused on what I'm doing. I'm certainly not out to personally compete with anybody. If they're competing with me, I don't know. But
and I didn't mean it in terms of like I want to win and I want them to lose so that I win. But when it comes to mindshare, you're asking for 0.5 of this person's mental capacity, and they have a total capacity of 10.
Yeah.
So all day everybody's competing. As human beings in a modern society, even internally, you, the compliance guy, and the 12 others who are competing for their mindshare are all competing for their mindshare against just the daily routine work that they do, and their family concerns, and they're all the things, right?
Sure.
That a life is made of. That's how I meant it. Not in a I'm going to win, they're going to lose kind of way. But
the thing that's really, in my opinion, sort of interesting about innovation, especially within VA, is that we really focus on a 3-box solution. Okay. And so like with box 1 being present, so like day-to-day work, box 2 are, things of the past. So things that you really need to, like, that's the VA way. That's how we've always done it. And then box 3 is the future, which is innovations. And that's really where iNET and innovation within VHA lives. And so when you go to a staff meeting, or you go to, you have these training sessions that people sign up for. So they're interested, they want to come. So they're there to see what you have to offer. And you start talking about these boxes and, how do you balance the past, the present, and the future. And you really look at like human-centered design and, building your innovation strategy, sort of maintaining that box 1. So maintaining the day-to-day stuff, because everybody's got day-to-day stuff. You got to do it, right? It's life.
If it takes 90 days, it's got to get done, right? Like those
But sort of learning to let go of things that are in box 2. So what can you get rid of? What no longer brings you joy, value? It's no longer serving a purpose, like, who asked for that spreadsheet? Do we really need it? Why am I still doing this? And then when you manage box 1 and you get rid of box 2, or some things in box 2, or you start unpacking things in box 2, you are creating space for box 3, right? So you are intentionally creating time for innovation. When I start telling people about this 3-box solution, they're like, ooh, never thought of it that way. I am interested in unpacking some of box 2. And I do want to create intentional time or protected time for innovation, all while maintaining that box 1. And then, so it really sort of changes their mindset of how they think about sort of just their day-to-day. So I don't feel like I'm necessarily competing in that sense, because I feel like people, they want to know, they want to learn. They'll take that time, or they'll skip that other meeting or that other thing because they want to come learn about some of the things we're doing. Yeah. It's new, it's exciting, it's different. We haven't done it here in Dayton before, so in terms of at the Dayton VA. But then, on the flip side of that, how do I maintain that, right? So how do I keep them engaged? How do I keep them interested? So luckily, I have an amazing programming curator who comes up with creative content for me. So, I can just keep pushing it out. But yeah, I think people, I don't feel like I have to compete, because I feel like people want to know.
Do you have regulars? Like, do you have any people that just keep showing up?
Yeah.
They just keep ideating?
Yeah, I do.
Oh, do you? Okay.
Yeah, which, good and bad. Sometimes, like Dr. Short is
bad if they
definitely
don't learn to filter, if they're not getting better at it.
Yeah, like Dr. Short's, he's a regular. He has a ton of amazing and creative ideas that that constantly keep me engaged as well, so I'm always like, so what's the next thing? What are you going to do now? Okay. So I kind of find maybe I'm a regular to him. But, and, but then there's other people that, sometimes, I think they're so caught up in the, I want to invent something, or I want to innovate. And it's like, okay, but you really haven't, worked through this. You haven't really come up with, something that's going to be able to be implemented. And so
some people are great ideators, and it's really energizing to imagine what could be without thinking through the laborious process of producing that. Right. That's the difference, I think, between ideation and innovation, is just all the grueling execution details that need to be done in order to implement. Or invent a thing, right? Yeah. Inventing something is not thinking of an idea.
Right. Or coming up with an idea that you want somebody else to solve. Like you want somebody else to do it.
Wouldn't it be great if this was just automatic?
Yeah, I get a lot of that. So I do have to oftentimes, go back over, like, I'm not the project manager of your project, like you are. I will help you with whatever you need. If you need to 3D print something, or you need an IRB, or you want to do an IP, whatever it is, but you have to do the work. So I have a lot of people who want to bring ideas, but then they expect somebody else to do the work. So
you mentioned earlier about creating space for people to innovate. Yeah, I do some leadership. I do a leadership coaching for like 2 people. I was having a conversation with one of them last week about, getting to the point where the demands of your work, the urgent things that just have to be done now, are less than the time you can give to your work, in order to intentionally budget for yourself time to think about what to improve or think about what to innovate. And as a leader, if you're buried in production work, like if your surgery schedule is just such that you're just jumping from one incision to the next incision or whatever, you're not going to innovate anything, right? You've got to be focused on this patient. You got to do the paperwork. You got to do all the production things or whatever your business is, whether it's operating or, providing care or whatever it is. There's production work that you have to do as a leader. You have to do your one-on-ones. You have to do all the, so that you have to, it's like you have to budget time for that. I like what you said about having to intentionally create space. One thing I've observed is that a lot of times really creative people, if they're go-getters, if they're doers, the organization has a tendency to give them more to do, and you can bury some of your best minds. If they're also executors, they're doers, right? They do stuff. And if they're highly productive people, they tend to create a magnet for more workload. And then there's no bandwidth left. What can you do, or is there anything you're able to do or think about doing, or that the innovation, the broader innovation organization of the VA is engaged in, to protect and kind of combat the problem of creative minds being unknown or unidentifiable because they're buried in production. They're buried in their productivity requirements.
That's sort of the beauty of iNET. When you submit an innovation project to the iNET, whether it's through, like I said, Spark Seed Spread, or one of their other programs, one of the things that is required is that they have buy-in from their supervisor. And so with that, we're able to provide them with that protected time. So, whether it's 1 hour a day or 3 hours a week, whatever it may be, when you join the programming that iNET has to offer, that protected time is built into that. So I have an investee right now who the first week of December, her and I will be going to DC, and we're going to a boot camp accelerator.
Okay.
So part of her commitment to her innovation project is her supervisor is going to allow her to travel and attend these seminars and conferences and focus on her project. So we really strive to make sure that employees have that protected time to innovate within VA.
You ever run into, or have you ever heard of ideas happening and a leader doesn't back it, doesn't want to buy into it? And I wonder how often it's the case because they don't want them distracted from the demands of the job.
Yeah. It's unfortunate, but they're out there. I mean, I've seen other employees who had great ideas but didn't have support from their supervisor. And it's disheartening because, I always think if you're really truly a good leader, a good supervisor, that you would want to empower your people, and that when your employees are, an creative innovator within VA and they're getting national recognition and winning awards and things, that only makes you look better as their supervisor, right? Because you supported that. But, I haven't had an actual innovation project yet where that's been the case.
Good.
Sometimes I think it really helps that we have executive leadership support. So my interim medical center director and all of the executive leadership team in the director's office, innovation is very high on their priority list. So I meet with them monthly. We have one-on-one sessions. And those are things that if or when the time comes, obviously would be brought to their attention. I think sometimes people just need a little push from their boss sometimes. So
that's key that you have that an executive level engagement, because, I'm a manager who's trying to be a director, or a director who's trying to be a VP. And I know my executives are assessing how well I support my team. They're getting credit, they're spending time, it's creating more demand on my department or whatever else. But at the end of the day, when I, as a leader, a manager, I'm trying to be I'm trying to become an executive or whatever, maybe I don't, get credit for that innovation, but I get credit for enabling and supporting it.
Absolutely.
Right? Like I get recognized and respected because I'm a leader who I want my team to shine, right? I want them to win. So that's cool that you got kind of that level of engagement and support
in the organization.
Incredible. I would think if it's all about meeting the deadlines, getting the production done or whatever else, that would create a tremendous infighting and conflict.
I think ultimately at the end of the day, everyone wants to improve veteran outcomes, and they want to improve the experience for our patients. And innovation is key to that. Anytime you can, improve a veteran's experience or an outcome, like with what Dr. Short's doing, these minimally invasive procedures are same day surgeries. They come in the morning and they go home that afternoon, with like a Band-Aid.
Yeah.
And whereas previously, you had to see a thoracic surgeon and they were splitting your entire chest cavity open, and you had weeks of recovery and potentially readmission for infection or readmission for rehabilitation post-op. And so to be able to not only shorten the amount of time that we're delivering that care, but really change the outcome for the veteran through minimally invasive procedures and reduce readmission rates and reduce the risk for infection. It's just really changing the way we deliver healthcare in general.
Yeah. I had an old boss who used to say, I'd have a win or something, some deal would come through. He'd be like, "Good job, give me more." And so sometimes it was exhausting to never be able to stop and celebrate. But the upside to that was, and the point that I was thinking about, when you think about that, the 90-day treatment that you're able to now provide that same treatment in 7 days. It's the kind of thing you want to celebrate and you want to enjoy the great feelings you should all have about what better care. The way that translates to quality experience for those families and to that patient that's tremendous, right? It's not, you didn't just save 83 days, right? You saved 83 times everybody in that family, all the cousins and uncles that are asking, and all the anxiety that comes with that, times however many times that care is provided. That's a tremendous amount of value that's provided there, but it's not good enough. Right? So like tomorrow's innovation is going to think that's archaic, right? And that's the point you just made with that invasive surgery.
Yeah.
Like somebody invented that, cutting open that 7 weeks of recovery. And somebody was really proud and impressed with that innovation at that time.
Sure.
And then later it becomes the archaic caveman thing that you can't wait to just destroy, right? So all these innovations that we're doing now are somebody else's caveman behavior, right? A generation removed. But how far is that generation out? I don't know.
I'm sure there's a lot of thoracic surgeons out there who are not fans of Dr. Short, but
right, because that hurts, right?
we certainly are fans. So but it's all about what's best for the patient. So at the end of the day, sorry you don't get to cut someone's chest open, but this is what's best,
That's right. somebody else in the future will be putting all of your innovations to, to shame at one day. And that'll be a great thing.
Yeah.
I think a lot of, innovation has to do with not being content, right? It's about like knowing that there's always a better way. And eventually when there's some, technology in somebody's home that just like heals and repairs all the things or whatever. And it's as easy as programming your microwave to reheat your leftovers or whatever.
Right.
That's maybe when we can slow down.
Yeah.
Even then, that probably won't be enough, right?
Right. There'll be something better eventually.
Yeah. So how much do you get engaged with like external parties, like technologies or service providers, outside of the VA that enable or provide some kind of solution or resource or whatever? What's that look like?
Like I said, we just started October 1, so we haven't really had any of those instances occur yet where we've needed to go to a community collaborator. We do have an affiliation agreement with Wright State University, like I mentioned before. We are a teaching hospital, and we do have residents, interns that come through Wright State and work at the VA. So right now, our biggest partnership, I would say, in the community is with Wright State. Just bringing in young college kids who are doing a rotation or, doing clinicals or are looking for a senior design project. So really collaborating with them. But, we've met a lot of great people. That was part of the reason why I was at Launch Dayton. I met Matt from Ascend Innovations. And
that week as well.
Yeah, he introduced me
I interviewed his colleague, the president of Ascend, on this podcast, actually.
Okay, yeah, I saw it actually on your website. So, he was an incredible resource. He put me in contact with a lot of people. So we've since met with like Rushlight Ventures and Makerspace AI training for some of our employees. We are really hoping to connect with community partners in Dayton so that if or when the time comes and we need those resources, we already have a point of contact and we know exactly who we can go to and sort of who we can reach out to get that accomplished.
Yeah.
So I spent a lot of time up front just really networking, meeting with people one-on-one. Hey, what does your company offer? What does that look like in the federal government space? Are you registered in SAM? Can we do business with you? And if not, are you interested in how can I help you get registered kind of thing? So that if or when the time comes, if it's something completely outside of our wheelhouse and we just know that we don't have the bandwidth or the resources to do it, we know exactly where to turn. Yeah.
Sometimes I think the world evolves and progresses so fast we don't even know that like a thing is now a thing.
Yeah.
You know what I mean? It's like, wow, you can do that. That's automated, or somebody invented this or that. You don't even know that like an advancement has been produced. And I think that will become more and more the case for a number of different reasons, that solutions to problems and processes and whatever will be innovated and created and produced and in ways that we can't even keep up with. So I wonder if, is just like shopping the world of solutions that exist and finding a solution you can buy and implement a part of innovation, and where's the overlap there with just procurement or strategic sourcing, like shopping for some tool or approach to something that might be a way to innovate?
Yeah. So, I think there are times where, like you said, shopping for something is going to be the easiest or, maybe the most viable solution for what we're doing. I think it's going to be very dependent upon whatever that project or product is. Obviously, if it's a medical device and we need FDA approval, that's very specific. So we're going to have to go that route. But, sometimes even just something like with Ascend Innovations, they offer like hackathons. So maybe we get to a point where we have an overwhelming influx of innovation projects that come in, and we, within our own committee, are having trouble narrowing it down to what we think will go to implementation phase. And so maybe we need, Ascend Innovations or someone like Ascend Innovations to come in and help us really take a look at those and figure out, okay, how can we hack each one of these projects down and figure out sort of like what's our best option, or where are we going to get sort of bang for our buck, so to speak.
What actually can be done.
Sure.
Right? Like how do we get pragmatic? Yeah.
And while we have a lot of subject matter experts within VA in terms of, quality and systems redesign and innovation and HRO, which is our high reliability organization, there's obviously, standards and quality measurements and practices in place and all those things. But sometimes maybe we just need a fresh set of eyes, or we need somebody else to look at it from maybe a commercialization point of view. That's not something we typically do within VA. So we don't have a subject matter expert for that. So we have to look elsewhere for that.
I feel like I could spend hours talking about this, but last couple of questions, just for the sake of time, I want to wanted to get your thoughts on where do you see innovation at the Dayton VA going in the next year or two? And what obstacles are you concerned with? What kind of concerns you about getting there? What challenges are you kind of focused on overcoming?
So where I see it going, we, like I mentioned before, we're the largest integrated healthcare system in the United States, and we serve over 9 million veterans. Recently, the PACT Act was enabled, and that essentially offers eligibility to veterans who may not have previously been eligible. Okay. So we're expanding services to veterans and increasing the amount of veterans that we're taking care of over the next several years. And so, with that, what does our bandwidth look like? How are we going to support that? How are we going to make that change from our current customer, which is really our Vietnam veterans? They're the bulk of our veteran population right now. Okay. But in the coming years, we know that that's going to switch over to our Iraqi war veterans. And so, our Vietnam guys are very different from our Iraqi war vets. Sure. So how do we close that generational gap within healthcare? How do we make space, and how do we expand services for all of these new veterans who are now eligible for benefits that we previously weren't taking care of? So really where I see innovation going is new ways to take care of new veterans and delivering care to them in the way that they want. Our old school guys, they like coming in and checking in at a desk and having that face-to-face with a person. Some of our younger guys and girls, they don't want to do that. They want to check in on their phone, and they don't want to talk to anybody, or they want to scan a QR code when they get there, and they don't want to sit in a waiting room. They want you to ping them when you're ready for them on their phone, or
Yeah, that different generation has a different set of service quality expectations and the way they interact.
So really innovating new solutions and new ways to deliver care to a new generation.
That's huge.
Yeah. So I think that's sort of the direction that I see innovation going at the Dayton VA within the next couple of years. Your
customer base, kind of growing, that's a huge obstacle. Sure. I'm glad you're focused on it. Yeah. That's a big one.
I think more so some of the other obstacles are budget. It's the federal government. Budget's always a concern. Are we going to have the resources? Are we going to have the funding, to take care of these veterans? With that, what's next after that? Does the VA expand services to spouses or children? Or, where does VA healthcare go, 10, 15, 20 years from now? Yeah. And then how do you plan for that? And how do you budget for that? And so I think funding's always an obstacle. Like I mentioned before, how do we deliver care to people that we've never taken care of before? So really looking at what we've been doing, what's been working well, what hasn't, and then how do we improve upon that so that we can stay relevant? Because while some people have to come to the VA for their care, some people come there because that's their choice. But a lot of our younger guys and girls who have jobs, have private health insurance and could choose to go elsewhere. And so how do we stay their first choice for healthcare? So I think really just sort of diving deep into who we are as an organization and figuring out how to move forward and how to close those generational gaps. I think those are going to be some of our obstacles.
Yeah, those are big ones. I commend you for your longevity in the organization, staying focused on providing great care to vets. Yeah. That's cool. Thank you for being a guest on the show.
Yeah, thanks for having me. I really appreciate it.
Appreciate you, Liz. All right.